Hi, so next week I'm due to have a hair transplant. Now, it's been quite a journey to get there, and I feel it's quite important to help others in the same position because there is a lot of information out there and it's very difficult to know exactly where you should look, what you should read, and really what you should do if you're in the same position. So I'm 33 and I probably noticed my hair loss starting in my mid-20s. So initially it was just a little bit of recession, and then I started to notice more thinning in the frontal area. Now I've got quite thick and curly hair, so at first I was able to disguise it quite well, and to a degree I can still do that. But as the thinning increased, this became much harder. I really had to be a bit better at styling it, and I'd have my hair cut in certain ways so they'd be longer on the top, and it got to the stage where it was quite a challenge to cover it, and I was getting more and more conscious of this. Now at the moment I can see that this is the area where it's thinning the most. I seem to be doing fine on the sides, but it's really got a lot worse over the last kind of 5 years. I started using Regain maybe about 4 years ago, and I used that regularly. It was recommended to me by a friend who'd had really good results with it, but I didn't quite have the same good results myself. So probably got to about last year when I thought, look, I need to look at doing something a bit more kind of proactive, or it would get to the stage where I'd need to shave my head. Now, for some people that's a viable option, but I just felt that was quite definitive and I wanted to explore other options. So about January this year, I started looking on the internet, and there is a lot of information out there, so it's very difficult to know exactly where to start. I had a friend who'd had a hair transplant. He gave me some information, but you really need to do the research yourself. I contacted a few clinics. I had a few like Zoom consultations, and with differing results. I went up for a face-to-face consultation at a clinic in London, but I just wasn't really feeling comfortable with any of those clinics. I then thought I'd spend a bit longer looking at kind of the surgeons who are actually performing the surgery, if it did come to that, and I stumbled across the British Association of Hair Restoration Surgery, and this is a really good website which gives lots of information to potential patients on hair loss kind of causes and various treatments, and it's got like a register of members, and it's got a list of all the clinicians who are members of the association. And it's here that I found Dr. Ball and the Maitland Clinic. I went onto their website and it's brilliant. There was loads of really good, honest advice on, if what causes hair loss, if you're a candidate for non-surgical or surgical treatments, and it really gave quite an honest kind of view of who would be suitable for various treatments. It was quite good because I thought it certainly wasn't a clinic that was just trying to sell hair transplants. It was certainly seemed quite ethical, which I was really looking for. I then organised a Zoom consultation with the senior patient advisor, David Anderson, and he was, it took about a month to organise that, and it was about a 45-minute consultation. He was brilliant. He has actually had a procedure himself, so he immediately made me feel at ease, comfortable. I could talk to him about the problems, which is obviously quite an embarrassing thing. You're really opening yourself up. We talked about why it had happened and what we could do to help and whether or not I'd be a good candidate. Went through again, non-surgical, surgical treatments available, and he seemed to think I'd be a relatively good candidate for a hair transplant. So the next step was to book him for a face-to-face consultation with Dr. Ball. So that happened a little while back, and I went down to the Maitland Clinic, which is in Portsmouth. Really easy to get to, easy to park, because obviously it's, you know, a little bit nerve-wracking. When I got there, everything was very professional. Obviously during COVID, there's lots of precautions, but that was absolutely fantastic. When I got to meet him, he was brilliant. He was really good. Straight away, he was very thorough. I've got a medical condition, which means I have to take blood thinners, and he was very good at talking me through how that would affect the procedure and what we could do to help keep me safe, but also keep a good kind of clinical outcome. I wasn't keen on using finasteride, so we talked about kind of the pros and cons of not using that. He went through everything to do with the surgery. He drew a possible new hairline, and what was really good was he gives realistic expectations. So it's no good me thinking that I'm going to suddenly turn back the clock and look 18 again. I will, you know, have a realistic hairline for my age, and also knowing that there will still be some hair loss to come. Yeah, really good. I left the clinic feeling very positive about everything. And the next thing is next week I'll be having the actual transplant. I'll be having a pre-op the day before, where I will have my head shaved, which is obviously a little bit nerve-wracking. Also have the hairline drawn on my head, and then we're ready to go. So what I'll probably do is post another video after I've had the pre-op